Early detection is absolute key. It saved my life, and I really hope that it saves somebody else's life.
At just 37 years old with a 3- and 7-year-old, Kristen Johns had no signs or symptoms of breast cancer, but she did have a dream.
I had a dream from my aunt who had recently passed away telling me to go and have the mammogram.
At the same time, Rex employees received an email reminder encouraging them to get their screening mammograms. What was found changed her life. Johns had an aggressive type of breast cancer.
Breast cancer has come so far in the last 10, 20 years, and that news is devastating, but it is not a death sentence.
Kristen Knott, Johns' patient care navigator, helped her make sense of the diagnosis and treatment options. That's the unique role of the navigator.
The whole patient is so important, and we find that when we first meet these ladies, because the first thing that comes to their mind when they hear their diagnosis is, well, what am I going to do about my job? What am I going to do about my kids?
That total patient approach is part of Rex's comprehensive breast care program and includes the breast multidisciplinary care team. Here, patients are the focus of a conference that allows all of their physicians to discuss the best treatment options. Together, radiologists, pathologists, medical and radiation oncologists, even nutritionists are involved.
The patients then get the benefit of all these various specialists who come together and come up with a specific plan for their care, which is a lot different from meeting individual providers who may have different ideas about how to treat these conditions.
So many times there are issues that are going on with the patient that I, as a surgeon, might not know about. Social issues, financial issues, even nutrition issues. I mean, things that you just don't really think about as a surgeon necessarily that come out in this conference. Being aware of a variety of issues that are going alongside the primary treatment of the cancer really helps us treat the patient as a whole and their whole situation for the best outcome.
I felt like nothing was left untouched, that they were covering all aspects of my treatment, from my mental to my spiritual to my physical well-being.
And her patient care navigator, who's also part of the multidisciplinary team, was with her every step of the way.
She was the one that was there for me the minute that I woke up from the surgery. She was the first person to hold my hand. She was the first person to tell me that my lymph nodes were negative and I could relax at that particular point.